pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. This is a public comment. This is a time provided so that the public may speak to the council on any item on not on this agenda. It's not. It doesn't say not. Any public comment from the city council? I have a brief public comment. What? Go ahead. Do you have any public comment from the? I have a brief public comment first, and then I have something that we'll talk about actually related to the emergency motion, so I'll save it for that. I've learned that some individual council members have been discussing personnel issues with the city manager and suggesting he make certain decisions. This is inappropriate and shouldn't be done. The city manager makes personnel decisions independent of the city council because that's his job. He only takes directions from a majority of the council when the majority of the council agrees on that direction. So an individual council member cannot and should not be discussing individual personnel decisions and how they should be managed with the city manager. Thank you. Any other public comment? Do we have any members of the public that can they call in?
I do not at this time have general public comment. I will for item number 1.
Oh, but we don't have it available for this?
There is none right now.
All right. Oh, I mean there's nobody calling in. All right. Council business. Proclamation of a local emergency. By motion, ratify the proclamation of a local emergency by the Director of Emergency Services and proclaim the continued existence of a local emergency.
Yes, Mr. Mayor and Council, on March 19th at 11 a.m., I declared a state of local emergency due to the ongoing impacts of the coronavirus pandemic. By taking this action, it's important to note that the city is not at any additional risk. Really, it's an administrative function. It allows the city to participate in a number of local, state, and federal programs. It also allows us to apply for reimbursement should that become available down the line. Now, it's important to note that this entire region has been working together since the early days of the pandemic. Every morning and at 7 days a week, actually, we participate in a conference call with our county medical officer, Dr. Sissom. She provides us with an update of everything that has occurred in the previous 24 hours and then works with all member agencies in Placer County to develop their ongoing work plans. Quite frankly, they're probably amongst the management staff, we may participate in 5, 6, 7 conference calls a day. So there's a lot of work that is going on right now. Just this past week, most Placer County cities declared a state of emergency as we did. In addition, on Friday, most cities closed city hall operations to all non-essential operations. So what does that mean for you? It means that your police, your fire, and your utility operations are fully functional. However, at City Hall, we will be maintaining just a skeletal staff to provide administrative support for those operations. In addition, on Thursdays and Fridays, we'll provide a scaled down level of development services. So contractors and developers who need plan checks, permits, and whatnot still have the ability to come into City Hall and have those functions worked on. In addition, we have 2 Public Works employees that will be on duty 5 days a week, just keeping an eye on the city, making sure there's no significant issues going on. They also have the ability to pull back employees should there be any need to work on infrastructure type issues. Now, before I go any further, what I'd like to do is have you hear briefly from each department director. They've been very busy over the past few weeks. I'd like you to just get a feel of what they have been doing and where they're moving forward and how they're providing additional public safety for the community. Chief Ryan Kinnan, you want to come in?
Good evening, Council. Ryan Kinnan, the Chief of Police. So like the City Manager said, once we got this kind of the word, we've been meeting with our counterparts at the other law enforcement agencies throughout the county. But a big thing for us was trying to keep our staff safe as well as the community. So some of the things we have done to navigate and kind of go through this is we did close down our lobby. We've really turned everything into as much as we can automated. So we've moved to as much as possible using our website, using our social media, using phones, email, and all those things to be able to take reports, even doing things as registration for the sex registrants. I know the DOJ is working on a way of kind of putting that on pause in the meantime, but those are still things that the officers and staff have to deal with. So that's one example of things that continue. Other things that will continue in our services, really we have an emphasis on community outreach. We know at this time, more so than any that we've seen in our recent history, that people are looking for some calm out there. And I really believe that that role does fall on the shoulders of the police department. So I can tell you the men and women of the Auburn Police Department continue to go out there every day and try to continue that community outreach, letting everybody know that we're there for them. We're driving through community neighborhoods, letting people know that we're there. We've actually worked with the 4 stores over there, the grocery outlets, Save Mart, CVS, and Rite Aid. Again, the influx of customers there. We want to make sure that all of the community members are able to shop there and with no fear of being victimized for whatever reason. So these are all things that we're staying abreast of to be able to stay in front of. That's just where we are. We know that we got to be out there and be there for the community. So those are some of the things that we're doing.
They've been very busy over the past few weeks. I'd like you to just get a feel.
Yes, we've been very busy over the past few weeks. Thank you, sir.
Chief Spencer.
Honorable Mayor, fellow council members, Dave Spencer, your fire chief. We continue to adjust and flex based on the needs both for the county and our specific community here in the city. As Chief Police indicated, one of our primary concerns is our internal folks and trying to make sure that they're safe and continue to be able to execute their core mission. On March 16th, I submitted a memo to my internal staff to be effective for 21 days to take precautionary measures and continue to follow best practices to protect themselves as outlined by the Human Health and Services. Some of the items that we have canceled include non-essential training, community service and public education events, all ride-alongs, including family members. We're limiting station activities. We are ensuring that our staff are continuing to practice good hygiene and ensuring that we're adhering to the sanitary practices, and we're making sure that all of our people, if they're symptomatic in any way, shape, or form, that they're not reporting to duty. In addition to that, we're also looking for opportunities to continue to have a presence without compromise in our community. What that means is that we're continuing to monitor neighborhood by neighborhood, making sure that everybody has their needs met and that they're continuing to practice social distancing, and so we'll continue to do that. We also are continuing some of our fuel reduction efforts because it is important to keep some of this forward progress that we have started and have been so successful with. So just this today, we've completed all the pile burning below the Blackstone area and have done a significant amount of fuel reduction in that area. We'll continue into the Golden Virginia Street area in the near future. In addition, under the direction of the city manager, we did take the opportunity to stand up a COVID-19 safety action plan. I believe you have a copy of that. That was something that we felt was important to have some written documentation for us to follow. The challenge was making sure that this plan was generic enough to meet the needs of all of our city employees as well as the specific staff of first responders. And so I think we were successful in getting that stood up. And so now that we have closed City Hall and we're to a skeleton crew and primarily just directors, it doesn't have as much applicability, but as we move through this event, we'll be able to engage this plan as needed. So those are some of the things as a high level that we've been doing over the last couple of weeks, and I'm happy to answer any questions if you have any questions.
Thank you, Chief, for your report. We've heard through the media outlets that there's been a extreme shortage of masks and other protective gear. How are you guys from a inventory standpoint related to protective gear?
For the moment, we're doing okay. We have exercised our request through our California OES office and trying to stay ahead of the curve, if you will. So for now, we're doing fine. We're continuing to monitor our levels of personal protective equipment and continuing to make orders as appropriate, accounting for the lag in delivery time.
Great, thank you very much.
Director?
Mr. Mayor, if I could, real quick. Chief, excuse me. Are you taking any extra precautions as far as you're the only department that has firefighters that all live in a small area, and particularly our stations do not have very big dormitory barracks? Any additional precautions going for those employees? And and then I have a second piece to it.
Yeah, it's an excellent question. We continue to ensure that our staff are using good hygiene practices. As you know, with the limitations with the space, there's only so much space that we can create. So what we've done is bifurcated both stations so that the station in Maidu stays separate from the station on Sacramento Street, and continue to just do good practices. And if anybody's symptomatic, they notify their immediate supervisor, and they're relieved of duty using their appropriate leave time for that problem. And we'll continue to monitor that. At this point, our staff are doing well. They're continuing to use their best practices and are limiting their exposure.
Okay, thank you for that. And my follow-up question is, with 3 shifts, is there any precautions you're taking to try to keep those shifts isolated versus individuals who are working amongst those shifts who, if contagious, spread it amongst the remainder of the shifts?
Well, and I think the key to your question is that we're relying on our staff to monitor themselves for symptoms. Even though there is some data that says that you can spread as a carrier, there are really not a lot of data to show that that's a significant exposure. It's when you become symptomatic, and so that's really been the bulk of our message. Unfortunately, with constant staffing, which is a requirement for us that we have a firefighter in the position every day, 365 days a year, we do have some employees that are out on workers' comp injury, and so that creates a situation in which we have to move people around and provide the level of protection that we're used to here in this city.
Is there been any discussion with the County Chiefs Association as far as, for the reason you just explained, that can easily wipe out an entire shift, that can wipe out an entire department? Is there any discussion of how mutual aid would occur if that happens?
Absolutely. We've been in heavy talks with all the fire chiefs for the county, and so we are continuing to work through our closest resource concepts. We have basically had a handshake agreement at this moment in time that if one of our departments is short-staffed, that we could provide additional firefighters, and that may be reimbursable through OES, where we're looking through that process right now. And so there are many options for us to continue to provide the level of service and protection that we need. And as you know, Rockland was another example of one of those situations where it was impacted. And so as we see it, if there is a large hole, we will simply move our resources around to cover the entire area. And that's a collective agreement that we all have.
Okay, thank you. And my last question, and you mentioned the crews just finishing up behind Blackstone, moving to Gold in Virginia. Just want to clarify that the fire prevention, fuels reduction work in the canyon at this time will continue.
Absolutely. And remember that there's 2 components to that. There's the work that our fire department and burning that we're doing is specific to our department. I'm not going to use private vendors for that purpose. I think the risk is too great. But the contracting work for that fuel reduction continues on an ongoing basis.
Great. Thank you, Chief. Thank you, Mayor.
The only question I would have is, what accessibility do you have for testing if one of your firefighters becomes feverish, headache,
Right.
runny nose, dry cough?
Yeah, so one of the agreements that we have through the county public health office is that our first responders get priority testing. So we're continuing to put pressure on the public health system to make sure that we get the first option to do that as they become symptomatic.
And county health does have test kits available?
My understanding is that we're using some private vendors now that are able to provide that as well. So we're continuing to expand our resources available to us. So yes.
Thank you.
All right, thank you.
Director Schroeder.
I'd like to think that we're saving the best for last. Bernie Schroeder, your Director of Planning and Public Works. My challenges, or our challenges in the Public Works and Planning, are slightly different, to say the least. We are a department that has been most impacted by the furloughs. Well over 80% of our staff has been ordered, if you will, to stay home. So in trying to keep with the pace of the essential services, it's been a lot of creativity and honestly a lot of effort on the part of the staff, and I really have to hand it to them. I will highlight some of the changes operationally. We have full operation, as the city manager indicated, with the wastewater treatment plant, both sewer call-out emergencies as well as maintenance and monitoring, as we always have. The support of our staff to police, fire, and wastewater continue. The transit route reduction was part of the transit system, which changed. We went down to a single route. It's a 12-hour shift, 6 a.m. to 6 p.m. I have 2 drivers. They're doing a rotation. And we are, interestingly enough, noticing a bit of a uptick in the ridership in this last 2 or 3 days. People are looking to go get groceries and other medical-related shopping. Planning department, that's by remote only. One of our senior planners, Tanya, is actually out of country, expected to come back in April, so that should be interesting. We also have that ability to have on contract. So we're very limited in the planning itself. Building and engineering, as indicated by the city manager, Thursday, Friday is a time when, although the public is not going to be entirely an open door, but we've made arrangements so that there will be communication. We're also seeing an uptick in people inquiring about building permits, and I attribute that to a lot of the shelter in place. Everybody thinks about maybe a little home project that they can begin. They're just going to take a building permit. Also for construction-related activities, land development, we have staggering construction personnel. The airport, the operations itself are continuing. However, the office is closed. All the meeting rooms are closed. Fuel sales continue by threshold, so people can certainly still fly in and out of our airport. All the maintenance response continues with mixed forces, as I would describe it. It's a case where I get a daily report as to how the lights are operating, if there's any problems with any of the safety features associated with our runway, and I'm putting together a lot of different resources to address those. Again, wastewater is fully staffed, and we have that going on as usual. Nevada Street project, the sidewalk project is continuing. It had delays associated with the weather, but that is planning to get back on schedule as far as some of the final work. As it impacts the community and public works in planning and so forth, our whole department, I only have a few things that I think are worth mentioning at this point. Certainly, we don't have a sweeping schedule. Our downtown and Old Town restrooms have been closed. The multimodal restroom is remained open because transit and transportation is an essential service. And of course, landscaping in the central areas and the public areas has been curtailed. So that concludes my report. I'd be happy to answer any other questions.
Thank you, Mr. Mayor. Bernie, just one quick question on the building permits that
Yes.
you mentioned, including with an uptick here recently. Are we able to do those electronically, or is everything done the old-fashioned way? And if so, what mitigation efforts are we taking?
We have quite an elaborate table, if you notice out in the hallway. We do not have online submission of building permits per se. There is a creative way of doing it. You can apply for it. You can scan the application. You could scan your plans. You could put them in for submittal and submit payment. But as online send in the way that some of the other jurisdictions have it. We aren't at that stage. The system that we've employed is to minimize any public contact. So if somebody has a set of plans that they want to either submit, they make arrangements, they call the email right at the door, they can be dropped off. We go through our process, and then when they're ready to be returned, it goes into a basket that they can come in and get.
Okay, thank you.
Thank you.
I have some questions for the city manager. Obviously, furloughed employees are an issue for the city. How is their furlough being managed?
Currently, all furloughed employees are on leave time, their own leave banks. We're allowing them to use any leave that they have, being vacation or sick time. We are aware that some are already fairly low in their leave accounts, and we're taking that into account. These first days, my goal is to get basic stabilized functioning going on within City Hall operations. We will then start looking at rotating employees so they're not off on a consistent basis, and we can start to spread out exposure opportunities so we don't have the same people being exposed day in and day out.
Follow-up, do we have any contingencies for employees that might have a specific hardship related to this?
We don't at this time. You're going to be receiving a report from me. It's a kind of a two-pronged report. Right now, the city's been working on addressing coronavirus issues, and I do have a few issues such as that to wrap up with all of you and get some final direction, but I want a report in your hand first so you can kind of think through some of the issues. The second part of this that we really haven't been discussing so far are the significant financial issues that the city and essentially all cities are going to be facing based on the impacts of the coronavirus. We are working on finalizing our numbers right now and our recommendations for the city to walk into the future on those. So you will have that probably within a week addressing both sides.
Obviously, I appreciate that, but my question was more directed towards a plan for specific employees that might come forward with a hardship, how we would address that, and if we're going to have a plan for that.
That will be part of that actual discussion because it does have financial implications, so it will be in the report itself. Again, we're already aware of some of those employees, and we're trying to work them into regular operating schedules as well to the extent that we can.
It would be my opinion, and without speaking for the entire council, that we would be very concerned that we do take care of those employees. And I suspect that's going to be a general consensus. So I look forward to hearing that and being able to reassure our employees that we will do the best job we can to take care of them during these hard times. Mr. Spokley.
Thank you, Mr. Mayor. Bob, we've heard a lot of different reports about the federal relief bill that's coming through now. Are we aware of any programs specific to public employees that might help our public employees that we have here at the city?
We had one that was based on FLMA changes that, in fact, we were able to get into the hands of our employees on the day of the furlough, those updates. So if any of them are any of those new programs are applicable to our employees, we would be happy to honor those. We do know there's an awful lot coming down the pike from the federal government, but until we really see something that has been passed, it's hard for us to really determine what kind of impact it's going to have on our folks. And so as soon as we do have a passed bill, however, we will be working on that assessment and do everything we can to relieve the pressure on our people.
We've been reviewing in my personal business briefings as what's going to be expected, and we've been dealing with the private sector side of things, obviously. I'm sure there must be some relief programs for the public employees as well. So, yeah, certainly keep a close eye on it.
Thank you, Mr. Mayor. Bob, can you talk to us a little bit about your efforts or the city's efforts related to our businesses, particularly the small businesses? And you know, there's been a lot of information as of late with small business loans and other things, but can you just expand a little bit on those efforts?
early on, it became apparent that the hospitality industry was the first industry really getting impacted by this. And so what we did were a couple-pronged approach. First, we put together a package of all available funding opportunities for small businesses that are available at that time. We went literally door to door to most every restaurant. We talked to them about the opportunities. We talked about how you could still stay open. And in fact, a number of the strategies that we had talked about then are the ones that have remained in place today. Be quite frank, it was kind of heartbreaking. I mean, I had folks crying, wondering how they were going to stay open, if they'd stay open, how do they pay their mortgages. It has been very difficult on several of our local restaurants and businesses. What we did next was polled all the restaurants to see who would be remaining open, at least for takeout, curbside type services. Put together a matrix so we could hook our citizens with those restaurants that were staying open and still providing services. We wanted to do everything we could to try to drive those two together so our citizens who are staying at home could have some variety in their meals, and our businesses could keep their doors open and hopefully remain thriving to the extent possible. We've done the same thing with our retail businesses. We have been trying to contact those businesses that provide e-commerce services and try to hook them up with our citizens as well. Doing everything we can to maintain the disciplines and requests of the governor's office, as well as give and provide for shopping opportunities for our citizens right here in Auburn. So anything else that we can do and continue to do, we will. I've already promised all the businesses that we have distributed information to that as soon as it becomes available again, we will be distributing it again personally to them. We want to make sure we get it in their hands. So regardless if their business is open today, if it's closed, we know how to get in touch with most of them as well, and we will follow up.
Okay, thank you. And then one last question, and maybe it's too soon now, but any information or intel from Andy on forecasting tax revenues and what we're already seeing effect-wise?
That will be part of that two-prong report that will be coming out in a week or so.
Okay, thank you.
Yes.
And I assume that two-prong report will reveal the effects that we view of PERS who've lost a lot in their portfolio having on the city in the future. Is that correct?
Absolutely.
I've been remiss. Anybody on the phone have any questions for any of our participants? Can they hear me?
Hello, I'm Sandy Amara speaking. Can you hear me?
Yes, go ahead, Sandy.
I just want to thank everyone, Chief Spencer, Chief Canan, Bernie, the city manager. It looks and appears, and I know you've been working very, very hard, and I appreciate that. And so all my questions were asked and answered, and I just want to express, this opportunity that we have here to work together is vital now, and I appreciate all your hard work. So that's all I have to say.
Councilwoman Mackey?
Thank you, Mayor Kirby. I want to echo what Sandy just said, but I also want to ask the city manager a question about all this information that we're gathering. Is there a way, Bob, that we can combine all this information and get it on our website as a resource page, frequently asked questions, things, businesses that they would be able to click on our website and be able to go to all these resources that are available? Is there any way that we can do this and then maybe get it on our city's webpage? And also, not just our as well.
I'm sorry, could you repeat the last part of your question?
Not the last part was not just for our businesses, which very important, but also for our citizens as well, information that they might need, because we've all had questions, I'm sure, from our constituents about, what is happening with the city, what are the hours it's opened, et cetera, who's working, who's not, that sort of thing. Can we get a concise resource page on our website that helps our businesses and helps our citizens? It shouldn't be we have all the information. Just need to get it in one place.
Absolutely. We'll be able to have something like that up by late Friday or Monday, and we would appreciate any feedback from the council of additional information that you would like to see on an ongoing basis, and we will have that available and updated on a regular basis.
And also one other question. Are some of our employees working from home?
We have one employee working from home.
Okay, so okay, that's it. That's all I needed to know. Thank you.
Thank you. Before we hear the motion, I have a couple of comments. As your mayor and a physician who's on the front line of this, and also with a master's degree in microbiology and infectious disease, I think it's pretty important that I give you my perspective. A teenager who is known to be otherwise healthy just died in Los Angeles today of the coronavirus. This is not a hoax. People have to take this very, very seriously. The average patient that ends up in an ICU is there on a respirator for 21 days. That will dominate the ICUs of this hospital if it occurs. New York has 525 people currently on respirators. That's pretty much all they have. That's the city of New York. This is very, very serious. The effects on small business are catastrophic. Bob and I have been talking to a lot of them. Bob's done the yeoman's work. Most of the small businesses in Auburn will have a great deal of trouble making 2 weeks of this. Please, if you can, get takeout from our local restaurants that are open. Support the people that are there. This is our community. And tip them generously. They're very, very grateful when you do it, if you can afford to do it. The next thing I want to emphasize is social distancing is critical. This virus can die out if it loses a host, if it can't jump from one person to another. Once that person is no longer contagious, they can't give it to anybody else. But you can pass it to people for at least 5 days prior to having any symptoms at all. I've been talking a great deal lately, about 5 times recently, with Mike Howard, the ranger. I was hiking several times this weekend in Cool and drove through the canyon. There was no social distancing at the confluence. It might as well have been the beaches in Southern California. Therefore, the ranger asked for my support, and several council members have chimed in that they agree to stop all parking at the confluence of the river, except for the very few designated parking places. There will be no parking along the roads. We encourage people to hike. We encourage people to get out in the outdoors, properly spaced. I did it multiple times this weekend, and it was easy to do. But down at the confluence, when I drove by, it looked like there was a packed crowd on No Hands Bridge watching an event. There was no social distancing. They're coming up to the rangers directly, touching them, and putting everybody in danger. So this can't be tolerated. So the city is expressed its support for state parks for closing the parking along the roadways at the confluence of the river. We are not telling people not to recreate, not to mountain bike, not to hike. We want them to do that. But keep your distances. No more group larger than 6 known people. Stay apart. You know, you're happy to talk to people along the way. That's all part of what we do. It's good for us. Keep your distance. As far as the distancing, I said I would not pet any bears or mountain lions. That was my promise. But I was up in Cool, and there were virtually nobody up there. There were very few people. Go to places where we have miles of parks in the Auburn State Recreation District. Please keep your distance. Utilize them. But this is absolutely critical. We can beat this virus as a community. but the social distancing is what's going to do it. Currently, where I work, which happens to be right now in Woodland, but I've also talked to the chief of staff and the CEO of Auburn Faith, where I worked forever, we're okay, but we're going through masks and gowns at a horrendous rate, and we will run out. So please don't put the caregivers at risk. If you have a problem, if you have a dry cough, a fever, or runny nose, call your primary care doctor, find out where you can get tested, and self-isolate until that test comes back negative. And most of them will. The vast majority of people that we're testing down in my clinic, all of the people we sent in for testing with symptomatology have so far, God bless, been negative. But West Sacramento, where my daughter lives, just had 3 new cases. The virus is out there and it's in the community. Please, please, please do this. It will not be over in 2 weeks. It will not be over by Easter. There may be select parts of the country that can return to normal sooner, but the bottom line is all of us are at risk, and all of us are putting everybody else at risk by going out in the community and not practicing social distancing. Please do it. Go to the grocery stores, go to the post office, do the things you have to do, but take common sense precautions, and we will beat this. It's not going to be tomorrow. And keep in mind the incredible hardship it's going to be on your friends and neighbors. If you have an elderly neighbor or somebody that's infirm, inquire about them. Ask them if they need anything. Pick it up for them. Our police and fire department is available. We can't do things for everybody, but if somebody truly has a crisis, contact us and we'll find a way to get them help. That's what the city of Auburn is here for. But everybody else, practice common sense, take care of your neighbors, and we'll get through this together. But once again, as a physician, I can very clearly tell you, it will be over maybe in a month, maybe 2 months, not in a few weeks. Probably more like 2 months if we follow the rules. And during that 2-month period of time, many of our friends and neighbors are going to have a very, very difficult time. So reach out to them, be available for them just to talk to, okay? It's very, very important we support each other. Now,
Mayor, I'd like to make a motion.
Absolutely.
Excuse me, Mayor and Council, I do have one public comment for this item.
Go for it, please.
This public comment is from Alice Dowden Calvillo. I just wanted to take this opportunity to thank the City of Auburn for taking the proposed action today and ratifying the proclamation of a local emergency. This will provide our city with vital funds and services to assist our community during this unprecedented time. Also, please continue your communication efforts as it's important residents and businesses remain in the loop. Lastly, I encourage the city to host a virtual town hall meeting, if you will, bringing experts like representatives from Placer County Health to present the latest information in their efforts to fight COVID-19 while allowing citizens to ask questions. Thank you again, and please stay safe out there.
Thank you. Any other comments from the council? Any other public comment?
That is all for public comment at this time.
Motion.
Mr. Mayor, I'd like to move that we ratify the proclamation of a local emergency by the Director of Emergency Services and proclaim the continued existence of a local emergency.
I'll second it.
Only comment I have on this is that this action was taken by the city manager with the concurrence of myself as mayor and Vice Mayor Spokley, who were both aware of this. So it was done in concurrence with the council leadership. That being said, any comments from the council members on the phone? Seeing none.
No, I'm ready to.
All right, we'll call the motion then, please.
Councilmember Mackey,
Aye.
Amara,
Aye.
Berlant,
Aye.
Spokley,
Aye.
Mayor Kirby.
Aye. Motion passes. I'll now entertain a motion to move to closed session.
So moved.
Second.
All in favor? Second? Aye.
Aye.
Motion
Aye.
passes. Closed session.
Yes, we can use my cell phone.
Yeah.